Welcome to the 479th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. We finally got some rain. Welcome. Thank you for listening. We haven't had any rain. We've had 3 days straight of rain, so forced me to go onto the treadmill a little bit because of the lightning and thunder. But today, I went out with the dogs for a little bit before I came in for the treadmill, and we got wet with both rounds, but we didn't melt, and there was no lightning, so it was all good. As far as the ankle and the injury report, we're moving right along. I actually consulted with a physical therapist today just to make sure that doing the right things, there wasn't anything more to do, and he agreed. So, doing what I'm doing, increasing my mobility, actually running pain-free for the most part. Have a little bit of trouble getting going, maybe a little trouble afterwards. Depends on what kind of shoes I wear later in the day. Have some discomfort, but it's just a matter of increasing the endurance of the small muscles in my legs. And I like something that the physical therapist said today, made me happy to hear. It's like my bones, my first metatarsal joint has limited mobility from years of wearing pumps and high-heeled shoes and tight, narrow shoes in the front, and nothing I can do much about that. I do exercises to improve the mobility, but the good news is the muscles adapt around the bone. So we have a skeleton, and it might not be the best looking skeleton, but if our muscles are good, they adapt and they'll take care of things. And that was a good thing to hear, and, again, reinforce behavior that you got to keep the muscles good. So no matter what the bones are doing, whether they're bent the wrong direction, or you're missing bones, or you have broken bones, or they're fragile bones, if the muscles are there, everything is going to be okay. Big takeaway for today. So, years of doing flat road work, or little hills once in a while, but road work with marathons didn't really strengthen those little tiny stabilizer muscles of my feet. And so they're getting a workout now on the trails. So they're gradually catching up. So it's a matter of keep increasing their endurance. And the question always comes about how much to do and how much to rest. We recover when we rest, but if we don't push the limits, increase the volume a little bit, then we can't push the endurance of a particular muscle. And with ultra training, endurance is what it's all about. You have to train for the distance or whatever you're going to do, and as specific as you possibly can. So the rain allowed me to get on the treadmill and do some hill repeats, a mile for a hill, a mile running, a mile hill, and gradually increase the grade. So I did a couple days of 6%, and then today I did a 15% mile. And if you want to know how much elevation you're achieving, all you have to do is take the grade of your treadmill and multiply it by 5,280. That's the number of feet in a mile, and you can figure out how high you're climbing. And so today I did a mile at 15% and got a whopping 729 feet of gain. Silver Rush, the 50-miler that I got in the middle of July, has a total gain of 7,503 feet. And if I toe the line at the Leadville 100, that is 8,000 feet of climbing. So I got a bit to catching up to do. But luckily, when you do hills on a treadmill, you're actually, it's a pretty good strength workout. And you're really working on your glutes and your hamstrings and your core. And it's if you can't stand the pounding of running, I strongly suggest hills to people. Put that treadmill up and play with it. Treadmill's pretty boring, so you got to play games with it. So use your hills up and down, vary your speed. I always look at times. Can I beat my time? So there's ways to get around. I use the little track, and I look as I'm going, how far I have to go. So I play a lot of mind games with the treadmill. I actually trained for my first marathon almost exclusively on a treadmill. My daughter was young, so I only had my mom would watch her on Saturdays, but the rest of the time I would run on the treadmill so I could be home with her. and worked out all right. Did okay with that first marathon, so it can be done. Treadmill's probably a little bit more forgiving. Today I went outside and I could tell a little difference, it was a little bit more stress on my ankle with the roads. I had to get used to it a little bit. So I do think that treadmill is, because it's flat and doesn't vary at all and it's a little softer landing, it is a little bit more forgiving, but this is not the time in my training to be forgiving. So it's the time to buck up and get strong. So that's what I'm all about. I am guilty of this as much or maybe more than a lot of people, but I look online or I look what people have done as far as their training or their volume, and I forget to take into account what their age and experience is, perhaps their biomechanics, and often I try to push the limits a little bit, and over the years I've intermittently gotten in trouble because of that. So I, recently saw online somebody, put a prescription out there for health and what to do for cardio. And, just because somebody has, some sort of a name behind them as far as a influencer doesn't mean that you should try to emulate what they do as a workout. So, you want to push your own limits, but you have to start where you are and work accordingly. And you have to push the envelope, but again, knowing what you're capable of or what you've done in the past really plays a role. That's why a lot of times, just going online and getting a training program, it works okay, but, it's not necessarily ideal because, again, everybody's just a little bit different. Time circumstances come into play, but it's a good starting point. And so if you're looking for workouts and you go online and just get somebody else's workout, be wary about where it came from and perhaps look at a range of what you should do and kind of pick where you are. And again, don't be afraid to adjust it. Sticking to something just because it's written down and everybody else does it doesn't make it ideal necessarily. So I saw someone today, this week actually, in the office that came to talk about, do they need back surgery? And this particular person's had back surgery in the past for a condition called spinal stenosis. So most back surgeries are avoidable, but there are a few instances where a surgical correction is needed in order not to cause permanent nerve damage. And one of those is if there is enough deterioration in the spine that the canal is impinging on this spinal nerve itself, or the cord, that has to be decompressed so that people won't get permanent damage. And some of those symptoms are, and they can mimic disc disease or other nerve disease, but the difference is that it's more like angina in the heart, that because the spinal cord is being compressed, there's a lack of oxygen, and the more people do, that's when the symptoms start. So just like when people exert themselves and they get chest pain, but if they're just sitting around, they don't have chest pain, same thing happens with spinal stenosis. The cord, the longer you're pushing on it and occluding it or pinching it, then it starts to not get enough signals down distally, and people can, their legs can give out, or they can have, the pain starts then. But typically it's a weakness that occurs. They can have bowel or bladder changes or loss of sensation, but it's usually the longer. And if they're sitting, they're okay, but if the prolonged activity, which is very much different from traditional nerve pain, where it tends to be more on the constant side, starts from the beginning and might actually get better as people get warmed up, because there's usually a muscular component that's causing the body to be muscle spasms and or shifts in alignment that's causing people to have pressure on a nerve and they get nerve pain. And by fixing some of those or letting some of the muscles relax as you do something, that's why walking can be good, it gets better. So if the pain gets better, nerve pain gets better from walking, it's probably not spinal stenosis. But if your legs start to give out and you have to find a place to sit down, then that's certainly more, you need to see your healthcare provider very soon to try to get that fixed. The other thing that we worry about, if people all of a sudden have what we call foot drop, that they can't pick up their foot, it just drags, or they have a complete numbness of the foot or lower extremity. That's something that needs to have some attention done. But for the most part, active therapy and specifically walking and different means to engage the core and take the pressure off the low back often lets the disc even heal, even if it's protruding and sticking out. It's like the disc is kind of like a water balloon that kind of ruptures and blood vessels form, and that retracts with time. The problem is nerve pain is very debilitating. It's kind of like a toothache. It never really goes away. It wakes you up from sleep. It's there your every move. It gets worse. It can be electric-like and get worse and radiate down your leg, and kind of drives people crazy. So it's the point where do something now, and they really don't want to wait. But anyway, this person came in, and the reason why they thought they may need back surgery is that they had surgery before, and they didn't get complete resolution of their problem, and the question was, do you need to go in again? Well, that's the problem with back surgery, is most back surgeries end up leading to another back surgery because of scar tissue or change in alignment if there's fixation. So that's always a risk. But what happens more often than not is that there's scar tissue and people quit doing the exercises, and so there's more muscle deterioration and more malalignment, and they start to have issues again. This particular person's concern was balance, and part of the story was they went from independent living to assisted independent living, so living in a facility where you no longer have to take care of your house or your yard, or so everything's done. They don't have to cook. They go. The biggest activity is if they can go to the gym if they want to, or they can they have to walk to dinner, or they can travel about as freely as they want, but there's really no need. So activity decreased. This person also had an illness, an infection, and so she was down for a while. So again, in 2 or 3 days in bed or sitting around, you start to lose a lot of muscle mass. And somebody that's already lost muscle mass, balance goes. So surgery is not the answer for a balance issue by any stretch of the imagination. But when we looked at her, she had a typical look of, leaning forward, grasping the ground with her toes and her head of her body. So if you start from top to bottom, you got the weight of your head pulling your body forward, you have the weight of your body pulling your body forward, and the only thing you're grabbing onto as far as trying to balance is squeezing your toes onto the ground. So it's a recipe for imbalance and loss of balance. You can't catch yourself when you're already falling. The other thing that happened was because she felt a balance issue, she started walking with a walker. And if you can imagine, how when somebody walks with a walker, what they do is they lean even more forward. So they lean on the walker. She gets out of a chair. She leans on the arms of the chair. When she sits down, she uses her arms and then plops. So not hardly using her legs at all. And then when she did, balance, was her posture was such that it was difficult to get into alignment. So it's a pretty easy fix, but again, you got to do the work. So she's going to physical therapy, but you got to do exercises on, when she wasn't in physical therapy and on her own. And again, when you don't feel well or you're weak, it's hard to push. It's hard to keep going when something hurts. It's hard to do when you don't feel like you're making any progress. So one of the things that I had her do was keep a log. Where are you in your progress? How far can you walk without the walker? How far, do you feel like your legs are ever going to give out? And she's pretty sure that wasn't the case. And to do some exercises as part of activities of daily living. So, when you get up in the morning, when you're brushing your teeth, there's a few things you can do, some chair squats before meals, a lot of things to improve, and then just plain walking, holding on to the front of the treadmill as opposed to the sides of the treadmill so that she stays more upright as opposed to leaning over. So that was, she felt pretty happy when she left, and that was actually a very rewarding conversation because Somebody that's in their 80s, surgery carries a whole host of risks. Again, you're going to put somebody into a hospital bed for a couple days. They're going to lose more muscle mass. You're going to get into scar tissue, the risk of anesthesia with dementia. So it's really not the way to go unless you're in really, really big troubles. I had somebody come in to talk about the practice, and they kind of brought their wife in to kind of trick her. He said he wanted to trick her into getting here so that maybe when she heard the story about what we do, then she would like to change her diet, because he was interested in adopting more of a plant-based diet, even though he didn't know what it was. But he had some neighbors that were actually plant-based, and he'd like to give it a go because both of them had been healthy until they hit about 60. And then they got cancer diagnosis and blood pressure, all kinds of different lifestyle disease diagnoses. And now they're on medications and going to the doctors all the time. And he'd like to put a stop to that, but he needs help because she is the cook. And, at one point they said, cheese, that might be a deal breaker. Where do you have to do it all the way? It's pretty hard and all these other kind of things. So the desire was there, but I don't really think they were quite ready to, start dipping their toe into the plant-based nutrition water. Hopefully, and the sad part about it is they have some neighbors that are plant-based, so they're not isolated. And if you do it with your partner, then that's even better. Obviously, both of them could have benefited from being plant-based, but again, it's going to take a little bit. They hadn't seen Forks Over Knives. They hadn't really read anything. So, I had them watch a few movies and read a few things, and perhaps they'll come back around. I saw one of my carnivore friends, or she's not really a carnivore friend, but a carnivore person post on Twitter that she's 45 years old and she has high cholesterol, but she has a negative calcium score, so there. Healthy as a horse. So don't bother her about cholesterol causing cardiovascular disease. Well, the problem is she's just now getting to the age where plaques are starting to rear their ugly head, so they're not going to be calcified. So a 45-year-old is probably not going to have a positive calcium score unless they have a pretty good family history and multiple risk factors that led to plaque formation and plaque, small micro tears in the plaque and calcified stabilization. But for the most part, people in their 40s aren't going to have a high calcium score. Doesn't mean they don't have vascular disease, because you can't see soft plaques with a calcium score. Soft plaques are the one that ruptures and causes acute myocardial infarction. In women that don't smoke and don't have diabetes, you're protected until menopause. It's very rare in non-smokers, non-diabetics, for women to have cardiovascular disease before the age of 50. Unless, again, a very, very high cholesterol, but usually in the presence of some sort of metabolic abnormality as well. I've seen a diabetic at 32 have a bypass. When I was freshly out of school, I didn't believe it could happen until I saw it with my very own eyes. Certainly there's people in their early 50s that start to have cardiovascular disease. Again, the more risk factors you accumulate, the more protection from a premenopausal status that you lose, so to speak. So negative calcium score in a 45-year-old woman is not impressive. So, it's not the reason for everybody to say cholesterol doesn't matter and you can eat what you want and blah, 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 blah. I think that was a disservice type comment, and I believe she was a healthcare provider. I'm not entirely sure. But again, you have to be wary of things online, of people that have miraculous recoveries from, lost 200 pounds on a blank diet and everything is perfect and all these kind of things, because usually it's not as it seems and not without struggle or strife. So, I've been doing this, we've had our practice since 2015 as a plant-based nutrition, cardiovascular, and primary care practice, and very few people have just transitioned without any kind of issue or struggle. Everybody struggles. Everybody has struggles. And so if you see somebody that seems to be gliding through life without any problems, it's probably not getting the whole story. So beware. I also heard of a patient this week that had a history of stents, went to see his doctor, still had risk factors, in his late 80s, and was referred directly for heart catheterization and then a series of stents to be placed. No symptoms, goes to the gym, walks, no chest pain whatsoever. That, my friends, is malpractice. The risk of a heart catheterization, stroke, heart attack, or death is still a very real possibility. Vascular complication, the older you get, is a very real possibility. And there's no improved longevity, not in the presence of an acute heart attack to receive stents. No, for nobody, forget the age. And certainly no reason to go directly to a diagnostic catheterization in these days in asymptomatic individuals. And in an 80-year-old plus, unless they were having symptoms, I would not even do a stress test. Life is a stress test for people that are over 80. If they're having symptoms, their energy deteriorates, then we look into lifestyle changes. Certainly if somebody were unstable, it's a different story, but in the absence of being unstable, you can only cause more damage. Kidney failure with the contrast that's used in a heart catheterization along with other stuff. The list goes on and on. An embolic event, a stroke. So you can take someone that's living independent and make them dependent right away. So don't fall for something like that. And don't let your parents fall for something like that. People want to know the one thing they can do to protect them from lifestyle diseases such as cardiovascular disease or cancer. But turns out there's not a one thing. The good news is everything that protects you from cardiovascular disease is also going to have a protective effects down the stream with other lifestyle diseases. But, thinking that taking one pill for whatever and looking at one problem and solving that is going to fix everything is the same type of reductionist viewpoint that we, kind of throw rocks at physicians for, only treating one part of the body and not looking at the whole person. There's lots of things that interact, certainly more than one, and just focusing on one thing and ignoring the others or thinking that if you take care of one thing, the others can slide a little bit is faulty thinking by far. So, again, in the taking a medication, whether it be for obesity or hypertension or hyperlipidemia, but not exercising and not eating a healthy diet is ultimately not going to do anything to really protect you. And in fact, there was a study that came out looking at, who should take statin medication. Should we put people on medications just based on their numbers, or should we look more into risk factors? And recommendations have been based on potential for cardiovascular events, not really looking at cardiovascular events. And so formulations, algorithms, looking at things that may happen is not as accurate as looking at things that have happened. So when they look back and they did calculations based on actual incidence in age groups and risk factors, about 50% of people that are on statins really aren't going to derive any benefits and may be at risk for the side effects of statins. So we've gone from, I think they should put statins in the water. There's a group of individuals that want to do over-the-counter statins, to now, about 50% of people really don't need them. So considering that statins were the biggest moneymaker for pharmaceuticals before Ozempic and weight loss drugs, that's a pretty good hit. Maybe they're just letting that be published because they have the weight loss drugs, and so don't worry about it. If you lose weight, you won't have high cholesterol anyway, so there won't be a need for statins. I'm not sure where they're going from this, but needless to say, if you're given a diagnosis of high cholesterol, do dietary modification. It actually works, and you can repeat. If you're worried, you can repeat your lipids in 3 months, again in 6 months. Nowadays, you can get laboratory tests. You can actually get them for yourself online, but you can also, there are a lot of cash places that do lipid profiles pretty cheaply. So you can, pay cash and look at them on a short-term basis if there's a question or a worry. But the main thing is to adopt a whole food plant-based diet and decrease your risk factors from a whole host of other things. So when I first went into private practice in Florida in cardiology, I came upon a book, and I'm not sure how, but it was one of Dean Ornish's first book on how to reverse and prevent cardiovascular disease. And I'm not sure that a patient didn't give me the book, but I did read it, and it was it looked like a paperback novel for the most part. And I read it, and I thought, this is a really good thing. And I actually gave that book out to some of my patients saying, hey, you should exercise and eat right. This diet is really good, but, you got to be really strict. And I think his first book was more Mediterranean than it was whole food plant-based, but nevertheless, it was based on, fruits, vegetables, whole grain, maybe a little fish back then, meditation, being engaged with your family or friends, exercising, stress reduction. And it worked. It worked so well that, he had actually done at that time a very good study looking at people with heart catheterizations and actually showing regression of the plaques he would sit there and measure them with calipers and showed people's coronary artery disease actually improving over time with the plant-based diet. This was way before calcium scores. He repeated it using a PET scan, looking at the blood flow to the heart, and showed improved blood flow with adopting a plant-based diet and his protocol. He showed reversal of prostate cancer with a moderate Gleason score. Doing this, he showed reversal of carotid disease. So his studies were very, very well done and supported by University of California, I'm pretty sure is where he came out of. But they were very well done studies documenting reversal of disease. And then, of course, Dr. Esselstyn came along and did, a patient population study looking at outcomes over time, which, again, supported his disease. So we have in the plant-based community both patient outcomes over time and actual disease reversal when you look at heart catheterizations or PET scans or ultrasounds. So we have that data, and yet it's remained very, very well hidden. And people still argue, keto, low carb, whatsoever, and statins out there. But, it's just a little too hard for people to make the change, perhaps. But one thing that's very, very worrisome, and people think, well, you can live through a heart attack, you can get a stent, you get a stent. I've heard a cardiologist here in town say, go ahead and eat your stent, go ahead and eat your steak. If your stent is closed, we'll just open it up again. No worries. Well, you can't do that with Alzheimer's. You can't do that with dementia. Once that gets going, it's pretty hard to turn it around. And the medications, no matter how much they cost, don't seem to be doing much. And Dr. Ornish decided to repeat these studies in Alzheimer's and early dementia patients. So his study was just published, and it's a very elegant study. It's something that everybody that's not plant-based throws plant-based people under the bus. They say, well, you don't have any clinical trials, you don't have any randomized trials. Well, this is a randomized controlled phase 2 trial that took people with early Alzheimer's and early dementia, and they based that on the Montreal Cognitive Assessment Score of 18 or greater. So they had to have a diagnosis of Alzheimer's or dementia. They did not take patients, they were specific in this phase 2 trial, they didn't take patients with Lewy body disease or Parkinson's or advanced dementia. They stuck to a specific group. The idea was to do 100 at first, but the collection was done around the COVID time, so they were limited to 51 people. So it is small, but they randomized the people to either have lifestyle intervention, aggressive lifestyle intervention, or stay on, just keep doing what you're doing. And the people, and it was 20 weeks, and the people that were just keep doing what you're doing, they were promised that they could actually go and have everything, the intervention done, all the counseling and all the dietary intervention done, at the end of 20 weeks if they so chose. They didn't have to, but they could. So they did 20 weeks, and they gave the patients, they started out with the Montreal Cognitive Assessment, and that is things like remembering short-term memory, long-term memory, sentence used, drawing numbers, hands on the clock, language skills. So it's a very well-known assessment scan that can be administered and be re-administered with good. It's not subjective. You have some pretty good indications on how the study's done. You don't get better studying for the test. So it's a good way to look. And in addition to that, they looked at biomarkers of Alzheimer's disease, so those markers that are associated with worsening Alzheimer's or dementia. And they also looked at gut microbiome, because there are a few gut bacteria that are strongly associated with Alzheimer's, and there are some bacteria that are not associated with, or a decreased incidence of Alzheimer's. And this was, the basis of this study was had some other studies that had been done before it. There was a trial in the Lancet that looked at multiple risk factors, smoking, hypertension, depression, diabetes, obesity, physical inactivity, social isolation, chronic inflammation, oxidative stress, telomere shortening, increased sympathetic nerve activity, and they was shown that these people that had all these boxes checked had twice the amount of risk of developing dementia. There was a Finnish geriatric study that looked at reversing through diet and exercise, and found that people got better somewhat. It wasn't a randomized trial, but the people that didn't have an intervention certainly got worse. So again, Dr. Ornish did 20 weeks. They sent the people and their spouse the meals, so plant-based whole food meals. There were some nuts and seeds, but it wasn't like a bunch of snacks of nuts and seeds. And they sent their spouse, and for the whole time they gave people the food. They were encouraged not to eat food that wasn't in the study. Turned out that if you looked at the macronutrients, about 14 to 18% fat, 16 to 18% protein, 63 to 68% carbohydrate, and they didn't restrict their calories. And then they had them exercise, and they gave them an exercise prescription based on how fit they were to start with. So they progressed, but they wanted people to walk 30 minutes a day and do some mild strength training, again, based on their level of fitness. They looked at stress management through yoga, meditation, stretching, progressive relaxation therapy. Imaging was encouraged to do 1 hour a day of these things. There was online meditation, exercises as well. There was a support group, 1 hour, 3 days a week, that also had memory exercises, and they had mandatory Zoom sessions 3 times a week for 4 hours to assure compliance. And that is extremely important, because when you're trying to take a limited number of patients and see whether people get better, it's really important to see if what your intervention does actually works, as opposed to someone's interpretation of intervention. Certainly I have plenty of people telling me that plant-based diet didn't work for them. They didn't lose any weight. Their glucose is not under control. They're doing everything right. But I know, and they know, that they are not compliant with what we are prescribing. Anyhow, they also gave them supplements. They gave them omega-3, which is a bit controversial in the other realms of lifestyle diseases. But anyway, they had 1,000 milligrams of omega-3, actually 1,680 milligrams. They had 800 milligrams of curcumin, coenzyme Q10, vitamin C, B12, magnesium, lion's mane mushroom, and a probiotic that was a super bifido probiotic. Beneficial gut bacteria, Baltea, Eubacterium. Again, this is not something that you can take, but you have to give your body the nutrients to make them grow. So again, back to my carnivore friends and low or high-fat diets, you're going to select for bacteria depending on what you feed it. And if you don't feed it fiber, you're not going to get these good bacteria, but you may get bacteria associated with disease progression, such as Prevotella and Teresi bacteria. So that was an issue. They also looked at biomarkers for Alzheimer's, but as well as C-reactive protein for inflammation, hemoglobin A1C, insulin levels. And what they found was that their biomarkers improved similar to what the medication trial for Alzheimer's in only 20 weeks as opposed to 18 months in those trials. So they actually improved more so. They had improvements in hemoglobin A1C, insulin levels, beta-hydroxybutyrate. They had decrease in their LDL. So 20 weeks, just like Dr. Esselstyn. So if you put people on these diets and you actually follow them, they work. It's a matter of actually sticking to it. Consistency is key no matter what. And they looked at, say, they had improvement in biomarkers. They had a trend toward improvement in their tau proteins. They had a trend toward significant improvement in telomere length. The control group had worsening or no change. So, I mean, the results were similar to these other trials with cardiovascular disease. People got improvement in just 20 weeks, which was very good, but they were substantial lifestyle changes to halt and reverse the progression. The patient's compliance, so they looked at compliance, they range from 71% to over 120.6%. The more people did, the better results that they got. The more people did, the better results they got. The problem? It's a huge problem. Not too many people want to make the change, just like the people that came into my office. They want to eat cheese. They want to go out with their friends. They don't want to change what they cook or they eat. I can't, people come up with excuses. I can't exercise today. I was too busy. It's an afterthought. If everything else is boring, then maybe I'll do something, but otherwise they don't. So if people are living that kind of lifestyle and they start to get dementia, it is very difficult for them to ultimately change once they've got dementia. And you can imagine that if a spouse is going to take care of a patient and they are not cooking like this and they're not plant-based, it's a pretty hard transition. So it's better to make these lifestyle changes before you get sick than after you get sick. The exception to that rule would be if you have a caregiver that's willing to do it. But anybody that has a family member with dementia or early onset Alzheimer's, now is the time to make aggressive lifestyle changes. Things can be slowed down significantly without the risk or side effects of these medications that may cause vascular disease, embolic events, and death, and all this other kind of things. Some of the Alzheimer's medication cause people to get depressed, or they start to become psychotic, they can't sleep. This is not what you want. Yes, some people want take a pill and do what you want, but in the presence of Alzheimer's, in the presence of cancer, in the presence of vascular disease, it's time to really buckle down and be aggressive and consistent about your change, so that you can reverse things, and you can reverse things. I shared this study with my group tonight. I give an online lecture to our members, and one of the members commented that, we appreciate your sharing things, and I know it must be difficult when you talk and it falls on deaf ears often. And it is true, and part of the reason why I'm so passionate about it is that I have seen people do well. I have seen people get better, angina go away, diabetes improve, cancer stabilize, and it's very important to me that you have this opportunity to do things. It's not for everybody. It's certainly not for everybody. I used to go and give lectures to different groups, RV parks and, church groups and hospital rehabs, cardiac rehab, and people would be very polite and listen, but they had no desire to change what they were doing as far as eating. People go to cardiac rehab after they have their stents or their bypass for 6 or 8 weeks, and once it's over, they go back to doing just what they did before. So it's certainly not for everybody, but it is a viable option to those people who want to live an active, healthy life until the end. We're all going to die, but it would be better, as far as I'm concerned, to not be dependent on your children or caregivers or in a home, not know where you are, be a burden to your family, not be able to do things later in life. So my goal is to be able to run as long as I possibly can, and when I can't run, support other people, or when I can't run long distances, run short distance or whatever. We have a member in our group that's going to be 89, and she's still doing 5Ks about every other week. So I want to be that. I want to be someone that is very active, living independently for all the days of my life. And in order to do that, you've got to train for it. So just like I'm pushing my ankle training, I'm going to push my lifestyle risk factor modification training as much as I can. Doesn't mean that you can have a dessert now and then that's plant-based, but there's all kinds of options that are plant-based. Doesn't mean that you can't have good food, because I believe everything I eat tastes good. So I'm not giving up on taste. My food is good. It's colorful. I enjoy it. I love the exercise component of it. And I love the mental stimulation that I get at work and with friends and learning new things. And those are things I'll continue to do, including this podcast. If you would like to join our practice in a variety of different ways, whether it be nutrition consultation, whether it be just access to our online lectures and private membership content, or would like to be a full-fledged member of the practice, and have me at your beck and call, basically, go on over to drdulaney.com, DoctorDulaney, and check it out. Love to have you if you're ready to make some changes and you want to have a happy and healthy lifestyle. The best way to get started is early on, but it's never too late. Never, never, never too late. So get out and take a walk, do some squats, step-ups, get your nutrition dialed in, take on a challenge or two to stimulate your mind, and I'll talk to you next week. Thanks for listening.